You wake up, your head is throbbing, and every muscle aches. Sickness usually hits you before you even get out of bed. In those first few hours, figuring out exactly what kind of virus you have is notoriously difficult. Looking at this diagram, you can see a massive overlap in how a cold and the flu present themselves. A hacking cough, a sore throat, and heavy fatigue sit right in the middle, shared heavily by both. Judging your illness purely by how terrible you feel in that moment will often lead to a misdiagnosis. This timeline illustrates your actual window for action. The moment your symptoms start, a strict 48-hour clock begins ticking down. If you guess wrong and rush to urgent care for a common cold, you pay for a doctor visit, but the medical intervention won't shorten your recovery arc at all. Doctors cannot cure a cold. On the flip side, if you assume it's a cold, stay in bed, and actually have the flu, that 48-hour window for antiviral treatment closes. Your illness extends significantly because you missed the cutoff. To avoid those traps, you need a clear triage framework to know exactly when to stay in bed, when to call a doctor, and when to head to the ER. Diagnosing a respiratory illness is a time-sensitive resource allocation problem. You are deciding exactly where to spend your time, your money, and your immune reserves. This flowchart starts with the most important variable: symptom onset speed. A cold builds gradually. You'll typically see a stuffy nose, hacking cough, and fever under 100 degrees. The flu hits fast, going from fine to extreme exhaustion, dry cough, and a spiking fever over 100 in hours. You have to monitor your temperature and energy levels objectively during that first day of sickness. You cannot just ignore it and hope it goes away. The speed of your decline gives you more actionable diagnostic data than the severity of pain. If your symptoms are gradual and your fever is low, your protocol is strict isolation, prioritizing heavy hydration and getting total rest. Drinking plenty of fluids, like water or warm bone broth, prevents the dehydration caused by your fever and helps break up chest congestion. Support your immune system's production of germ-fighting white blood cells by increasing zinc intake through foods like red meat and lentils, or a standard supplement. Saltwater gargles and essential oils will soothe your throat and sinuses, but they do not actively kill the virus. This route saves you the financial cost of a doctor's visit, but you trade away several days of productivity to let your body recover. You are successfully managing the environment so your immune system can work, but you have to be patient as the virus runs its natural course. But if you experience that sudden onset and high fever, you immediately shift to the medical intervention route. This model demonstrates how prescription antivirals like Tamiflu work. By binding directly to the virus, they block it from replicating and infecting healthy cells. But they only work before the virus spreads. Past the 48-hour mark, viral replication outpaces the medication, rendering it ineffective. Taking this path requires paying for a prescription and finding the energy to secure a rapid clinical appointment while you feel terrible. It is a very strict ROI calculation. You accept high costs and effort today in exchange for a drastically reduced illness duration tomorrow. However, there are specific, severe symptoms that require you to abandon the standard flowchart entirely and take immediate action. If you struggle breathing, persistent chest pain, or sudden confusion, seek emergency care immediately. For children, the non-negotiable signs are gray or blue lips, extreme irritability, or signs of severe dehydration, like not urinating for several hours. You also need to watch for the double sickness, when a fever improves for a day but suddenly returns worse than before. This often signals a secondary bacterial infection, like pneumonia, taking hold while the flu has your immune system weakened. These red flags represent a critical failure of your initial immune response. You must escalate to the ER immediately to prevent life-threatening complications. This diagram maps our triage flowchart to your risk profile. Healthy adults with gradual symptoms take the home remedy route. High-risk patients with sudden symptoms must trigger the 48-hour antiviral window. Caregivers observing breathing issues or severe dehydration must escalate to the ER instantly. Keep in mind, getting an annual flu shot is the most reliable way to proactively improve these odds before respiratory season even begins. Treating a respiratory illness isn't a guessing game. It is a strategic decision dictated entirely by your personal risk profile and the exact speed of your symptoms.